COVID-19 cases are on the rise across the state tonight, including in Colombia.
The FDA approved the new vaccine for COVID-19 last week that'll target the KP2 strain. MU Health says while there isn't a surge in cases in Colombia right now, they are seeing more cases.
Our ABC 17's Nia Hinson joins us live in studio tonight. Nia, MU Healthcare says it'll get the new vaccine in about 2 weeks.
Megan Lucas, MU Health tells me today they'll get the updated vaccine the week after Labor Day, which could be helpful as cases in Colombia are the highest they've been in a year. I talked with MU Health to learn who should get the new vaccine and when. A new COVID-19 booster is coming to Colombia during a period of time experts are calling a wave of cases across the nation.
Numbers dropped off in the spring until in April. They're just about the lowest we'd seen them. It was looking really good, but now we're back up about where we were in January. It's the highest now, about the highest now it's been in a year.
The FDA approved updated vaccines for Moderna and Pfizer last week that targets the KP2 strain of COVID. Johnson tells me today a derivative of that strain is what parts of the state, including Colombia, are seeing right now. Numbers from the CDC show within the last week, out of nearly 5,000 tests taken in Region 7, which includes places like Missouri, Nebraska, Kansas, and Iowa, 19.5% of people tested positive for COVID. Now, that's a jump from about a month ago in July when only 13% of 1,500 cases tested positive.
I don't think it really rises to the level maybe of a surge when we're thinking about stress on public health resources. But we definitely are experiencing quite a few COVID cases in the community right now.
Morris says MU Health will get its first shipment of the Pfizer vaccine the week after Labor Day. She says she recommends if you're over 65 or are immunocompromised, not to wait to get the shot.
Those are folks who really should prioritize going ahead and getting their vaccine soon. Get it now. If you are younger, otherwise pretty healthy, or you've had COVID recently, then you might consider delaying the timing of your dose just a little bit.
Morris tells me the vaccine should last you about 4 to 6 months and said you should wait about 3 months after you've had COVID before getting the vaccine.
Thank you, Nia. Morris says it's important to remember that even though younger people are typically not at risk for COVID, they can still spread it and should take steps like testing if you feel sick.